Yes, thank you.
I too am ready. I'm sorry. Sorry, Senator. Go right ahead, Representative Abercrombie. I'm ready. I do have some questions also. Thank you.
So good morning, everyone. I'd like to welcome you to the Appropriations and Human Services Committee meeting today for a public hearing agenda on the 1115 demonstration waiver application for review. This is a waiver for substance use disorder demonstration waiver pursuant to the section 1115 of the Social Security Act. We will start with the order of our attendance. Who will be giving us information on this waiver. First up is Commissioner Gifford, and welcome on this.
Thank you, Representative, very much for having us. Senator Moore, Senator Austin, and I don't know if Senators Berthel and Minor are on because I can't see the whole team, but Representative Abercrombie, Walker, Case, and France, and the distinguished members of the Human Services and Appropriations Committee. Thank you very much for having DSS here this afternoon to talk about this very exciting opportunity that we have with this 1115 demonstration. I believe I am joined by colleagues from sister state agencies, DEMIS and DCF. I believe Deputy Commissioner Nancy Navarrete from DEMIS was hoping to join, and also Commissioner Durantis. And if she's not able to join, I know we have representatives from those agencies as well when we get to questions. So I thought what we would do, given the week that everyone has had, is that I would start with some brief introductory remarks and then leave it to you as to whether you wanted more detail. We submitted both a set of slides with an overview and obviously our written testimony. But with your permission, Representative, I'll do some brief introductory remarks and then pause for further direction.
That'd be great. Thank you, Commissioner.
We are here today to seek your review and approval of DSS's proposed submission to CMS of substance use disorder, also known as SUD, substance use disorder 1115 Medicaid demonstration waiver. This is an exciting and potentially transformative initiative. Because it reflects an opportunity for us to expand our Husky services to our members. It also reflects an opportunity for us to enhance the capability and capacity of our providers in the SUD delivery system. And it does that through training, through modernizing practice standards in SUD treatment, and through rate increases. And it does that by capturing new federal revenue that the state has not previously had an opportunity to capture. So with a few context setting remarks, as you know, today, residential treatment for a substance use disorder is paid for using state-only dollars. And the reason for this is due to a very long-standing, over 50-year provision in Medicaid law that prohibits Medicaid programs for paying for residential treatment in what's called an institution for mental disease, an IMD. The IMD, so-called IMD exclusion, which is the colloquial term for that federal law, prohibits us to pay for or seek federal Medicaid reimbursement for all of our SUD and other residential treatment, including SUD treatment at the Connecticut Valley Hospital. The intent of this IMD exclusion was to prevent states from keeping large numbers of individuals in institutional settings when they could be more appropriately treated in the community. So this IMD exclusion was part of the national movement towards deinstitutionalization. And it has, for all these decades, prevented state Medicaid programs for paying for residential treatment for substance use disorder under the guise of an IMD. So our intent through this waiver application is to request that CMS waive this IMD exclusion rule and allow Medicaid to pay for treatment services that occur in residential treatment programs. There's a long-standing recognition by CMS that the IMD exclusion has been an impairment, an impediment to residential treatment for substance use disorder. And so CMS formally offered this opportunity to states to ask for this 1115 waiver. And they have already approved 32 states to take advantage of this opportunity. We are confident that by following the federal requirements for these waivers, our waiver is likely to also receive a favorable review from CMS. So once the waiver is approved, all treatment services at residential treatment programs that comply with the new standards that are articulated in the waiver would become eligible for federal match for Medicaid reimbursement. This is significant for Connecticut and would allow us to increase our rates for providers in order for them to meet these higher treatment standards. DSS, along with DMIS, DCF, and the Department of Corrections, as well as our judicial colleagues, have been collaborating on this project for over 2 years to get to this point. Providers will receive increased rates to deliver these higher treatment standards. And we also believe that this will significantly benefit Medicaid members. They will receive more uniform and higher quality treatment. And our goal is to ensure that member outcomes improve under this demonstration. We will, in fact, be required to measure certain quality metrics and outcomes as a requirement of the demonstration, and some of the enhanced funding would go towards that effort. The funding details are still being worked through as we learn more about the providers and members that would be affected. We've had extensive provider feedback throughout this process, and we continue to modify the proposed standards within the federal parameters and the rates based on the meetings that have occurred over the past several months, including as recently as this week with providers. Our goal all along has been to be transparent and provide providers with the resources that they need to meet the higher standards and to attract and retain qualified staff. So at this point, Madam Chair, defer to you as to whether that's sufficient information to jump in on the questions, or if you want us to run through a couple of the finer details in the PowerPoint.
I will open it up to the chairs and rankings to see if they want further information or if they just want to go to questions. Rep. Walker. Senator Austin.
Thank you very much. I do have a couple of questions. One, you said that the DSS, and I'm not certain which parties were involved, but DSS and DOC have been working on this for 2 years. Is that true?
Yes.
And when did thank you.
Just to add, so some of the collaborators, Senator, DSS, DMIS, as I mentioned, DCF, Court Support Services, and Department of Corrections in terms of state agencies that have been working on this waiver application.
And when did the providers become involved in the process?
So I am joined by Kate McAvoy and Mike Gilbert, and I believe Bill is also on from DSS. So Kate, do you want to answer that question for the senator?
I'd actually like to defer to Bill because he's really been the lead on this, and there's been extensive stakeholder engagement. So Bill, may I ask you to respond?
Sure. In different capacities, they have been involved with us for quite some time. I would say in great detail, probably starting in November and December of 2020, where we were able to share our draft treatment standards with them for the first time. And then initial round of feedback happened. So in November, December, January, we went back, made adjustments to those treatment standards. And then recently, as Commissioner said, even we had 4 meetings this week, but I would say in the last 3 weeks, we have re-engaged with them significantly to show them not only the standards, but the draft rates as they stand right now.
And thank you for that. And my questions are not about the federal dollars. My questions are relevant to the timeline on how this all played out. When were the legislators first notified about this process?
I couldn't tell you specifically, Senator Kate. I don't know if you have a specific recollection or if we'd have to go back and look through MAPOC agendas, et cetera, as to when we first brought in our legislative colleagues.
Yeah. We first notified the Medical Assistance Program Oversight Council leadership and members approximately 2 years ago, describing this opportunity that became available to all states. And then we flagged the intent of the departments to collaborate on this. We presented a brief update on kind of plans for the stakeholdering at a previous point. And then this morning, we gave an extensive report out. Bill provided an extensive report out to the council.
And I would also just add, I think we've went back that far with the Behavioral Health Partnership Oversight Council as well.
And did you include these new rates in your budget requests through the Office of Policy and Management?
Mike?
Sure. Thank you, Senator Austin. The budget as currently constructed is neutral in regard to the 1115 waiver. Because of the time it's taken to work through some of the financial details, and as mentioned, some of the work with the providers around rates and discussions of that nature are continuing. So given the timeline from a financial perspective, it hasn't been specifically addressed in the budget. It is anticipated, and there's a reference to it in our testimony, it is anticipated that we will come before the Finance Advisory Committee and put forward any budget adjustments that are needed. I do just want to caveat that the budget adjustments will not be, there will be no additional costs. The new federal revenue is anticipated to allow us to fund the enhanced rates and other investments that are covered under the waiver. So it will not be an additional cost to the budget, but there may need to be some budget adjustments in terms of agency appropriations that we will address through the Finance Advisory Committee action. And we also anticipate that we would share information in advance of the FAC meeting so that there was full transparency around those adjustments before we get to the Finance Advisory Committee.
Thank you for that. And if you could send along those potential rates to the appropriate committees through their appropriate administrators today, so that we could look at that as we continue to work through the process. Thank you very much, Commissioner and your staff, and thank you, Madam Chair.
Representative Walker.
Thank you, Madam Chair. My co-chair has asked the questions that I had, so if I come up with any others, I'm sure to ask, but thank you, I'm good, thank you.
Senator Moore.
I have no questions. Thank you.
Pardon me, Senator. I wanted to add an addendum to Mike's comment if I could, but I'll defer if you'd rather ask your question first.
No, please proceed, madam.
Okay. So I just wanted to make a procedural clarification because, as we all know, Medicaid is nothing if it's not complicated. The 1115 waiver application itself does not require us to do the specific work around the rates. That would be done in a separate vehicle through a state plan amendment. And I'll ask Kate or Joel Norwood, our attorney who's on, to correct me if I misstated anything, but I just wanted to make sure that the committee understands as you contemplate approval of this waiver, that it does not lock us into any specific set of rates. It merely allows us to get the federal enhanced reimbursement for those residential services, which then we can use as a state to enhance rates and other enhancements and improvements to our substance use treatment system.
Representative France, do you have any questions at this point?
Thank you. I have one question. It's related to the federal reimbursement. So, as I understand from the presentation, that it's currently a completely state-funded program, and one of the drives within the budget was to look at opportunities to increase federal reimbursement. But on slide 9 of the presentation, it states that it must be budget neutral to the federal government on a per member per month basis. So how does that work in order to increase the federal reimbursement if it has to be revenue neutral in that way?
It's an excellent question, Representative. It is our federal agency that oversees Medicaid, CMS, has decided that they will allow us to consider these services as having been previously part of our budget, and then look at the services going forward as to whether they are cost neutral to the federal budget. So they call these hypothetical costs when they look at the budget neutrality calculations down at CMS. But all states have faced this challenge, and as I mentioned earlier, 32 states have gotten approval through the budget neutrality. So it is through a bit of linguistics that they allow these services to be considered to have been previously covered.
Okay, thank you very much. Thank you, Madam Chair.
And a few of our colleagues have raised their hands, but if anyone else has questions, please raise your hand. Representative Dillon.
Thank you very much, Madam Chair. Thank you very much, Commissioner. This is really very welcome. We know that the IMD exclusion has been a real thorn since before Medicaid, actually. It's Kerr Mills. But I have two question comments. One of them I think is obvious, and it's easily disposed of. NACHOG and Connecticut Mental Health Center are also IMDs, but you didn't mention them. Should we assume that they are included in this application?
To the extent that they're providing substance use disorder services that are covered benefits to Husky members, I believe the answer to that is yes. Bill, is that correct?
Yes. So your answer is absolutely right. To the degree that they're providing SUD services, they are included in this state operated one. And we have our colleagues from DEMIS on it, probably could answer it better, but I think it's more likely that the state operated ones are Blue Hills, Connecticut Valley Hospital, and Capital Region Mental Health Center. But I'll defer to DEMIS on the Connecticut Mental Health Center in New Haven as to whether they provide SUD treatment.
I think the Deputy Commissioner is on for, there you are. Good morning, Deputy Commissioner. Just introduce yourself, and if you want to just add to that.
Sure. Nancy Navarrete, Deputy Commissioner, DEMIS. CMHC does not have an IMD for substance use disorders. So the answer there is no. But to Bill's point, in terms of Blue Hills and the Merritt Hall building, the answer is yes, because they have the detox and rehab.
Thank you. And NACHOG, no, because those are, we're only looking at state operated?
No, NACHOG is part of it if they're, yes. They are part of it. Okay.
And second, I know that you don't have the dollars before us, but I can't stress enough how anxious our community is about whether or not we'll have the resources for the people that we're already caring for, who many of whose issues were driven by substance abuse, and the providers were hit very, very hard during the Malloy years, and in fact the the original, there were accounts in CMHC that, in Demas to avoid locking into rates, and they were pretty much, the grant accounts were decimated. So I hope, I don't know how this is going to parse out, but when it comes to COLAs and so forth, but we have some folks that really need it and providers that need to keep their workforces. And we just learned from the CDC, in addition, this morning, about suicide attempts having jumped in teenage girls a year ago. It's shocking. I don't know if that's driven by substance abuse, and I don't want to get ahead of the data, but I know that you care about that too, but I think we need to say that today.
Thank you, Representative. Any further questions, Representative?
No, thank you very much, Madam Chair.
You're welcome. Representative Nolan, followed by Representative McCarty.
Thank you, Madam Chair, and thank you, Commissioner, and everyone who's on assisting us with understanding this. I just want to do a follow-up on Senator Olson actually asked a question that I was interested in knowing, but along with what she said, conversation came up of even though the budget is not supposed to be affected by this, it was talked about making adjustments to agencies. So my concern would be is if those agencies are now going to have some kind of an issue just because of the adjustments that are going to be made. And if you knew what adjustments or what agencies would be impacted by this, so that we would be sure that the budget that we just brought forward is not going to be hindered upon.
Yeah, excellent question, and I'll defer to Mike, but just make an introductory comment, which is just to remind us all that this is enhanced funding. It's not, so it wouldn't entail any reductions in funding to the impacted agencies. This would be new funding that would be coming in to replace state-only dollars that are currently paying for these residential treatment services, Representative. So the FAC process that Mike refers to would have to do with moving or transferring dollars as they came in, as we were able to identify which providers and which services and which agencies were impacted. But we don't anticipate net reductions to agency budgets as a result of this waiver. The opposite is the case. Mike, do you want to add anything?
Thank you, Commissioner, Deputy Commissioner Mike Gilbert. That is all very true. I think it's more the mechanics of the funding. There certainly is no intent to have any services adversely affected. And as Commissioner mentioned, it is really about enhancing to the extent that some interagency adjustments are necessary to either augment agency funding or to allow for a maximization of revenue. Those would be the only adjustments that would be put forward, and only to the extent that they are needed. So we're very mindful of not adversely impacting any agency's budget through this transition.
Okay, and Madam Chair, if I can ask a second question.
Please proceed.
Okay, we talked about quality of treatment, and I'm just curious, who would be responsible for the checking in on the quality of treatment? How do we know it's different, elevated to a higher standard? Because we have so many agencies involved in needing to be part of this, it just worries me that there would not be an overseer in regards to quality of care. And that includes the measures of success in regards to some of the care that's being given. It seems like it's hard to follow the measures in regards to when it starts to finishing and finding out if it was successful. So I'd just be interested in hearing a little bit about that.
You're spot on, Representative. And in fact, one of the many reasons why CMS developed this opportunity for states was to address the exact issues that you've just highlighted. So the requirement is that providers come into compliance with the American Society of Addiction Medicine standards for treatment providers. And so it's a much more uniform approach to care standards than we have typically seen in the past. Those standards are high, as they should be, but they also require investment on the part of providers and on the part of states. So that's why this is such a great opportunity, because it provides us the federal dollars that we can pass on to providers to make the investments that they need to make in these higher quality standards. So in order for providers to answer your specific question, in order for providers to receive the enhanced rates, they will in fact need to certify or demonstrate that they are meeting these ASAM criteria in order to participate. On the quality measure side, every state is faced with the challenge of having the relevant data spread across multiple different data sets. We have DEMIS and DCF and DSS and DPH and corrections, and we have the Office of the Chief Medical Examiner. So we have a lot of places where the outcome data reside that we want to get. What this opportunity will allow us to do is to develop more capacity to collect and report on those measures across all of those different data streams. A small fraction of the money that comes into the state would be devoted to the evaluation component of the demonstration. And so we would be investing in our state capacity to collect and report on those measures that you just talked about.
Oh, thank you. And it just, if I can follow up with that data statement, is there going to be a certain area in which we're going to compile this data so that it's uniform, has uniformity amongst all these agencies so that everybody's on the same page? Because again, we fail to sometimes make it so that all agencies can intermingle amongst this data, and just making sure that that can happen.
Yeah. Bill, do you want to respond to that?
Sure. Thank you. Absolutely, yes. We will have our Behavioral Health Administrative Service Organization collecting and tracking outcome data across levels of care. So there are specific outcome measures that CMS wants us to follow. We may add additional measures, but all of those will be tracked and reported in a transparent way by level of care, probably not by provider. We'll probably roll it up to a level of care, but then the providers also will be able to see that and see their own measures and see how they are doing against their peers.
And if I may, I'd just like to wrap briefly around Bill. This is Kate McAvoy, Director of Health Services at DSS. This representative is not a new arrangement. It's a longstanding partnership between Department of Social Services, Department of Mental Health and Addiction Services, and Department of Children and Families to jointly manage the Medicaid behavioral health benefit. So there's years of trust basis and expertise that's been rolled up into this point. Beacon, the ASO, as Bill said, has great capacity around data collection, data analytics, and then also visualizing it so that we can share it in a way that's meaningful both for you and also for providers. So we're going to leap off that existing strength of the joint management by the three departments. We don't have to discern how to do that. We're already doing it.
Okay, thank you, Madam Chair. I will ask other questions offline to the Commissioner and to Kate, because I do have a lot of questions just to keep communication open in regards to mental health, because that is an important project.
I'm happy to answer them, Representative.
Thank you.
Thank you, Representative Lolan. Representative McCarty.
Yes, thank you very much, Madam Chair. Representative Nolan really touched upon my concerns, but I'd just like to make a few comments that I'm very pleased to see this demonstration waiver in front of us today. We know that the opioid crisis is truly a national concern. And for the federal side to really open this up to the state, I think is really an excellent move. So I'm very supportive. My question was going to be, and to recognize the interagency work on this for many years, that's tremendous. Representative Nolan hit it really correctly, that we have to look at what we're doing, what the standards are. And so my question to the committee is, will we be receiving another report after the work continues as to how those standards were raised, somewhat along the same lines as Representative Nolan questioned? I would be interested to see, because I know we're doing an excellent job, but if you can raise the standards even more, I'd be interested to see where you focused. Thank you, Madam Chair. Really
Thank you,
more.
Representative, and you raise a good issue. Normally, when DSS applies for any type of waiver, we normally do get some information as to how it's going. And then the financial part is also part of the appropriation. So I do believe that we do get this information. But if somebody wants to ask for a report, a year into this process, we can also do that. But normally we do stay informed as to how the process is going, how many people are being served financially. Like I said, it goes through the appropriations.
Okay, and I thought so. I appreciate you clarifying that. Thank you to everyone.
You're welcome, Representative. And just so members understand also the FAC process. The FAC process is a process where agencies need to come before a body that's made up of the executive branch and the legislative branch, and more or less really ask permission to move items from one line item to another. It's sort of our checks and balances when it comes to state agencies. So I just want to make sure everybody understands what that is. Representative Terziak.
Thank you very much. I just wanted one question. In the waiver, is CMS going to allow, and are we going to shift some job duties from higher classifications that are doing them now to lower job classifications that are not yet doing them in Connecticut? If you get what I'm talking about. Like having a professional, a nurse, substance abuse, somebody, and instead of the job that is normally theirs, have it be done by an aide or a lower classification. That's what I'm talking about.
Representative, let me provide a generic answer, and then I'm going to ask Deputy Commissioner Navarrete and Bill to also elaborate. The ASAM standards really actually raise the bar in terms of the types of professionals and the qualifications of the professionals that are involved in the treatment. And so by implementing these uniform and national standards, the intent is to bring up the level of provider that's providing these services. And that's one of the reasons why the enhanced rates are a key part of this. So there's certainly no intent to decrease the skills or abilities of the individuals that are providing services. It's to enhance them. There may be new types of providers that are involved in the services. So I would ask Nancy or Bill to provide any color or specifics that you might have in response.
I would also add generically that the teams would be multidisciplinary. So everything from physician, nursing, counseling, to include peers. So peers would be integrated into the teams, which is something we have wanted to do and have not been able to do to this point because of funding. So that would be an add.
Yeah, and I would just add it's almost going in the opposite direction per the commissioner's comments. We're enhancing the standards, enhancing the staffing. In some cases, we've added a nurse where a nurse didn't exist before. And to Nancy's point, we've added peers and we've added a dedicated service coordinator. And adding those positions, the peer and the service coordinator, we're not taking anything away from the staffing patterns of the professionals and the licensed staff. It's a true add to the staffing pattern.
Okay, thank you very much.
And just for those that are watching, ASAM is the American Society of Addiction Medicine. That's kind of like the book that we follow, just so everyone understands. I don't see any other hands raised. Is there anyone else that has any questions or comments? Seeing none, I would like to just open it to the Deputy Commissioner Nevada to see if you have any other comments that you would like to add to this, ma'am.
No, I would just say that we have been in lockstep with DSS in terms of developing the program, and that we are looking forward to the standardization of the rates based on a solid rate methodology. So that's important, hoping to improve access and be able to pay providers for the work that they are doing.
Thank you. And Deputy Commissioner Michael Williams from DCF, would you like to add anything to this presentation?
Sure, thank you, and good afternoon. And what I would add is first, thanks to Department of Social Services and its leadership, and particularly Bill and Kate for providing the leadership for us to do this. It's been a great experience for the Department of Children and Families. Collaboration that we've never seen before at the levels that we're seeing has been wonderful, and we really appreciate the product that has come out of this. And DCF and the rest of the state agencies truly are grateful for the vision and the leadership brought by the Department of Social Services.
And does colleagues, anyone have any questions for the Deputy Commissioner of DEMIS or the Deputy Commissioner of DCF? Seeing none, we will move on to our next presenter, who is Tyler Booth from the Intercommunity Healthcare. Tyler? Heather, is Tyler on? I don't see him.
No, he doesn't seem to be here.
Okay, then we will move on. Is Ben Shaken from the Community Nonprofit Alliance here?
Hi, good afternoon, Madam Chair.
Good afternoon.
Thanks for having me this afternoon, and good afternoon to you and Senator Austin, Representative Walker, Senator Moore, Senator Minor, Representative France, Senator Berthel, Representative Case, and all of the members of the Appropriations and Human Services Committee. My name is Ben Shaken. I work at the Connecticut Community Nonprofit Alliance, which most of you know. We're the statewide association of community nonprofits, representing all sorts of nonprofits, including those that provide substance use disorder services. I want to thank you for the opportunity to testify today. We are, in a nutshell, generally, supportive of the waiver proposal and of the transition for these services into the Medicaid program. But there is one important consideration that I want to bring up, and it goes back to some of the conversation you had earlier around the rates for these services, which, as DSS stated, are not included in this waiver proposal. Like I said, that just transition to the ASAM standards, I think, is a good thing. We think is a good thing. Will help the system, but it's very dependent on what the rates are for these services. And I want to just highlight several important reasons why. First, there's a workforce crisis in Connecticut. You've read about this as it relates to other industries, but it's very much present for community nonprofits right now. Human services providers across the state are facing significant staffing shortages due to how the labor market has reacted to the emergence from COVID. And for human services providers, including substance use disorder, this issue is really exacerbated because they can only pay their staff what the state pays them for services. We'd hope that this issue would have been addressed by the bipartisan budget that you all just passed. And it does for many areas of the human services sector. There's a really significant infusion of dollars into nursing homes, into group homes for people with IDD, and we're very grateful for that. However, the budget doesn't include any increases for Medicaid-funded mental health and substance abuse treatment programs. And it also includes some reductions in American Rescue Plan Act dollars for DCF and DMIS that had been included both in the governor's original proposal and in the Appropriations Committee's revisions last month. These programs are seeing an unprecedented increase in demand at the same time related to the pandemic. Just as an aside, we have just and are still experiencing the sort of third collective trauma as a society in the last 20 years with the COVID pandemic, with Sandy Hook here in Connecticut, with 9/11. And after each one of those, there's been a lot of discussion about the importance of behavioral health services, both mental health and substance use disorder services. But unfortunately, there's really been very little to no funding attached to expanding the behavioral health system to meet those needs. So within this context, mental health and substance abuse providers are just not going to be able to recruit the staff that they need to fill their existing positions, let alone the additional staff that is going to be required to meet the new ASAM standards that are part of this waiver. I sort of talked a little bit just now, I think, about some of the folks on the lower end of the wage scale in these programs, but this crisis is true for people on the higher end of the wage scale in these programs as well. These programs are highly dependent on clinical staff, nursing staff, medical staff. These positions are also highly competitive right now, and without an increase in funding for them in more than a decade, community behavioral health providers simply can't keep up with the private sector, with hospitals and others to pay their clinical staff. And the ASAM standards also increase in most of these levels of care the amount of clinical staff needed on site 24 hours a day. And then third and finally, the rollout of this plan, and I want to compliment and thank the Department of Social Services and DMIS for how open they have been with providers over this period of time. As Bill mentioned earlier, and thank particularly Bill, I think, for taking provider feedback. But as Bill mentioned earlier, providers have just found out what the draft rates are for this program as late as this week. There's a 3.5-hour webinar yesterday where Bill and Mercer went through it with providers in great detail. They're still trying to run these numbers to figure out if it can work with these draft rates, and that's going to take some time. But the idea behind this plan is to have a 2-year sort of transition rollout, and the details of that are really important. In the past, when services have moved to Medicaid funding, as Representative Dillon mentioned earlier, state grant funding that has funded them in the past has been reduced. And given the significant changes that this waiver is proposing to the services themselves and the time it's going to take, given what I just talked about, long established programs to make those changes, and given the significant state interest in substance use disorder, residential treatment in particular, in not reducing bed capacity and instead increasing capacity, it's really imperative that the legislature and the administration commit now at the beginning of this process to full funding and flexibility through the transition, including maintaining state grant funding as the transition is made. So I think that's all I have. Thank you again for your consideration. It's good to see all of you. I hope I can see all of you in person very soon. And I'm happy to take any questions. Thank you very much, Madam Chair.
Thank you, Ben, and thank you for your presentation. Senator Austin?
Thank you, Madam Chair. So Ben, I have a couple questions relative to the dollars. You know that the legislature put in some $200+ million for private providers. The administration in their settlement of an agreement with group homes or relative to DDS has used a lot of those fundings. Has your group done an analysis to see what the legislature would have to put in to keep the other private providers, in particular relative to DMIS, whole?
Thank you for the question, Senator. I think the legislature, you're absolutely correct, included a very significant increase in funding for private providers of human services. But as you said, a pretty substantial portion of that is dedicated to the settlement that was reached with group home workers who had gone on strike a week ago. I think the difference in funding, I don't know that I have an exact number for how to keep Demas specifically whole, because it's unclear exactly how the remainder of dollars are planned to be distributed based on the language that was passed on Wednesday. And, you know, as you all know, that language is absent in an implementer. And so there's a lot of question marks when you just sort of read the bill about exactly what the legislature's intent is behind funding. But the difference in total is that there is approximately $124 million appropriated over the biennium to the DDS contracts, and approximately $23 million, $23.1 million, 0.2, excuse me, in the biennium for providers of all other human services. So that's Department of Corrections, Housing, Public Health, DSS, DCF, etc. Demas is included in that. There's also in the budget $30 million in each fiscal year appropriated from the American Rescue Plan, including $30 million in the out year in fiscal year 24. But there is no language in the bill that passed the legislature that governs its use, and so I don't know, and I don't know yet what the intention of that funding is, and that's something that we're concerned with as well.
Thank you for that. And it looks like there are COLAs directly for private providers. Total 13.15 in year one and 13.15 in year two. Do you think, in combination with what they're trying to do here with rate increases, that this will stabilize this workforce?
Thanks. That's a good question, and I think it's important to put sort of what that may mean for providers into context. When you combine the 13.1 with the money appropriated from the general fund, it's 23.1, and that's probably equal, we think, to about a 3% cost of living adjustment on contracted services. In residential programs where there, which is sort of one of the parts of the behavioral health system where there are staff working at all sort of levels of the wage scale, for someone who's currently making $15 an hour, that's a 45-cent an hour increase. The negotiated settlement with the union, both for IDD group homes and for nursing homes, increases the minimum wage in those systems by the end of next fiscal year to more than $17 an hour. So the short answer after the long answer, Senator, is no, that funding is not sufficient to equalize the workforce disparity at the low end of the wage scale in these substance use residential programs.
Well, thank you for that. And the intention of the legislature when we put the private providers at was to bring all private providers up at the same time. The administration made some changes to that and signed the agreement relative to the issue. So we are still looking at this issue, but my concern has been and still remains today that by making decisions based on these settlements, that we're going to further discourage people from entering other workforces that don't have this same mechanism to in quotes, force the administration into a settlement deal with other private providers. It very much concerns me that this happened this year, which I look on as an historic year. Both Representative Walker and I worked for months on it to make sure that we were spreading things around sort of in a fair representation, and this worries me immensely. Thank you very much, Madam Chair. Thank you, Ben.
Thank you, Senator.
Thank you, Senator. Representative Walker, do you have any questions or comments?
No, I think my co-chair summed it up pretty well. We are disappointed in what has happened, and we hope that we'll be able to get some sort of support and relief to address that in the next couple of days. So thank you, ma'am. And thank you, Ben, for all your work and your advocacy for nonprofits and for people that serve the community, the Connecticut constituents. So thank you very much.
Thank you, Madam Chair. It's really great to see you.
Thank you. Representative Dillon?
Thank you very much, Madam Chair. Mr. Shaken, I realize, given what you just said, that you just got a run in a 3-hour meeting yesterday. So I don't want to ask you a question that's unfair to you because you're still trying to figure out the dollars. But going forward, I wonder if you could help us understand the impact of all of these decisions on access to care. And that's not always really obvious. We had a very detailed discussion about that when there were previous proposals concerning Blue Hills, when people would have been sent over to CVH. I mean, there's been a whole lot of budget proposals that sometimes were an attempt to deal with issues that, when you really came down to it, didn't make sense if people needed access. I don't know if you have all of that information from your members, and I would never expect you to have it today, given what we just learned, you just learned. But it would be really helpful if you could give us that information later.
Thank you, Representative. And just to address the first part of your comment first, you are correct. You know, providers of these services have over the last 2 weeks just been receiving the initial proposed rates, as Bill said earlier. It's going to take providers some time to sort of run the numbers, and the reason for that is because, in addition to, this is the new rate or the proposed new rate, the service model is proposing to change significantly, and so they have to not only just sort of plug the numbers, they can't just plug the numbers into their existing program. They have to sit down and plug the numbers into what a potential staffing model could look like or would look like under the methodology that you're considering today. And that's a pretty complicated process, and there's a lot of variables to it. Again, I just want to stress that we are, I think, pleased so far with the collaboration from the department. There are a lot of things that go into how the department and how their consultant determine what they think the rate should be, and all of those things are areas where providers may have a different opinion, and so that's where we sort of go back and forth about, hey, what's the hourly rate you used for this position? Well, we can't find them for this much. It actually needs to be that much. Or, well, my health insurance costs this much and you used this much. So those kinds of things are where we go back and forth. I will say, if we get to a place when the rates are finalized where they are not sufficient, especially when you consider the eventuality of the grant funding going to fund the state share of these services in part, at least, that it is something that is going to be very difficult to maintain, the access to care that we have in the state, which is already a challenge for substance use residential services, for substance use services overall. And so, this is an area of service that, human services that has been underfunded for a very, very long time. And so it is a very difficult proposition to make changes to that service model and have them be budget neutral and have those changes improve access to care. So I think that's sort of how to answer your question, that in addition to these changes, there really needs to be an infusion of dollars into the behavioral health system and the mental health and substance abuse services, so that providers can expand their services, can improve the quality of care, can pay their staff better, all of those things.
Thank you. And I guess I also want to thank the approach chairs for the leadership role that they played during the budget process. We're in a different place right now, and if we're going to serve the people, we need to figure it out. Thank you very much.
Thank you.
Thank you, Representative. Any further questions or comments? Seeing none, I will close this public hearing. and we will move on to the committee meeting. Madam Administrator?
Hello. I know you, I believe that Susan Keene said that Human Services would convene first and take the vote first and then appropriations. Am I correct, Susan?
Yes, ma'am. I believe we have to close the public hearing first. Correct?
Representative Abercrombie did that. Thank you, ma'am.
I didn't hear that. I'm sorry.
We're all set.
Okay, then I'll convene the Human Services Committee meeting for the purposes of approving the substance use disorder demonstration waiver pursuant to section 1115 of the Social Security Act. I'll entertain a motion.
So moved.
Seconded. Oh, sorry, go ahead.
Moved by Hughes, seconded by Representative Nolan. Are there any questions or comments?
Nolan's not on Human Services, so he can't.
Oh, I'm sorry.
I
thought it was
seconded.
But Representative Ethan also did.
Who? I apologize. Who was the second?
Kathy, I did. Case.
Oh, sorry, Representative Case. I heard the voice, but I couldn't find the face. I apologize. So it was moved by Hughes, seconded by Representative Case. Are there any questions or comments? Seeing none, Madam Administrator, please call the roll.
Thank you, Madam Chair. Representative Abercrombie.
Yes.
And just a quick reminder to the committee, as I have say your full name and title first, please, and then your vote. Thank you.
I apologize. Abercrombie, yes.
Thank you. Senator Moore. Senator Berthel. Representative Case.
Representative Case is a yes.
Senator Lesser. Representative Garibay.
Representative Garibay, yes.
Senator Cabrera. Representative Butler.
Representative Butler votes yes.
Representative Cook. Representative Dathan.
Representative Dathan is a yes.
Representative Goupil. Representative Hughes.
There we go. Representative Hughes is a yes.
Representative Santiago.
Santiago's yes.
Representative Simmons. Representative Stallworth.
Representative Stallworth, yes.
Representative Aurora.
Representative Aurora is a yes.
Representative Buckby. Representative Master Francesco. Representative Scott.
Representative Scott, yes.
Representative Wood. Madam Chair, is there any, actually, before I take the tally, is there anybody on Human Services who did not have the opportunity to vote who wishes to do so now?
Yes, Madam Clerk, Senator Lester in the affirmative.
Thank you, Senator. Any other Human Services members?
Did you call Representative Gibson?
You'll be on Appropriations, Representative. Thank you.
Okay, thank you.
Senator Moore was, I believe, that Senator Moore said she was coming on to vote, if you wouldn't mind.
I'll wait a moment. Senator Moore, are you here? Madam Chair, would you like me to give you the tally at this point?
I think we're waiting for Senator Moore.
We'll give her one more. Oh, you are wonderful.
Senator Moore, yes.
Thank you, Senator.
Thank you, dears. Take care.
Excellent, thank you. Give it just 30 more seconds in case there's any other members who wish to vote.
Please take the tally.
Representative Rosario on the affirmative.
For the human
Representative,
service,
you're on this is only the Human Services. Representative Rosario, you're next.
so for the Human Services Committee, that are 12 total members voting. Number voting yay is 12. Number voting nay is 0. Number of abstentions is 0. Absent not voting is 8. Thank you, Madam Chair.
The motion passes. We will recess to the Appropriations Committee.
Do you want me to run this part, Kathy?
Either you or Tony, you guys decide as chairs.
Go ahead, Kathy.
Okay, great. So I'll call the meeting to order for the Appropriations Committee, and I'll entertain a motion for the vote on the 1115 waiver application.
So
Second.
moved.
Mike Kursiak.
Moved by Representative Belinsky, seconded by Representative Turziak. Is there any discussion? Seeing none, Madam Administrator, if you could take the roll.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker,
Representative Walker votes in the affirmative.
Senator Hartley, Senator Hartley, Representative Dathan,
Representative Dathan is a yes.
Representative Nolan,
Nolan is a affirmative.
Senator Minor,
Senator Minor is yes.
Representative France,
Representative France votes yes.
Representative Abercrombie,
Representative Abercrombie votes yes.
Senator Doherty Abrams, Senator Doherty Abrams, Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Betts, Representative Belinsky,
Representative Belinsky votes in the affirmative.
Representative Candelaria, Senator Ciccarella,
Senator Ciccarella votes yes.
Representative Curry,
Oh, sorry. Representative Curry votes yes.
Representative Dillon,
Representative Dillon votes yes.
Representative DeMassa, Representative Felipe,
Representative Felipe in the affirmative.
Representative Ferraro,
Representative Ferraro votes yes.
Senator Flexer,
Senator Flexer votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Sorry,
Representative Gilchrist votes yes.
one more time for me, ma'am.
Representative Gilchrist votes yes.
Ah, there you are. Thank you. Representative Gonzalez, Representative Haddad,
Representative Haddad votes yes.
Representative Carol Hall, Representative Joshua Hall, Representative Harrison, Representative Hayes, Representative Howard, Representative Johnson,
Representative Johnson votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser,
Senator Lester votes yes.
Senator Lopes,
Senator Lopes votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory, Representative McGee, Representative Papalato, Representative Porter, Representative Reyes, Representative Rosario.
This time, Representative Rosario votes in the affirmative.
Thank you, sir. Representative Ryan, Representative Sanchez, Representative Sims, Senator Summers, Representative Terciak,
Representative Terciak votes yes. Thank you.
Representative Turco,
Representative Turco votes yes. Got that?
got that. Thank you, sir. I need to take a little pause in the action. Heather, would you please resend the link to Representative McGee?
I would be happy to, Madam Administrator.
Thank you very much. Representative Wilson, Senator Winfield,
Senator Winfield in the affirmative.
Representative Zawistowski, Senator Hartley,
Senator Hartley in the affirmative.
we will wait for Representative McGee to get his link, but in the meantime, is there any other appropriations committee member who has not yet casted their vote who would like to?
Madam Chair.
Madam Administrator, this is Rep. Porter.
Representative Nolan, may I please take Representative Porter's vote? Hello, ma'am. Activate your camera for me. Hi there. Representative Porter.
Hi, Madam Clerk. Representative Porter votes in the affirmative.
Thank you, ma'am.
Thank you, Madam Clerk.
Is Madam Administrator.
Madam Administrator.
Madam Administrator. Madam Administrator.
Thank you, ma'am. Yes, Representative Nolan.
Can you make sure that Representative Reyes also has a link he's trying to get out also?
Thank you, sir. Heather, if you could resend to Representative Reyes as well. Thank you.
Madam Administrator,
Yes, sir.
Senator McCrory is trying to get on as well.
Oh, help me, Lord. Yes. So Heather, if you could please resend the link to Senator McCrory as well. Thank you, Representative Gibson.
You're welcome.
It's only Friday, Susan.
I don't know if I speak to you anymore because you're not an Appropriations Committee member.
I wouldn't.
I try not to either.
Wow, I feel the love. It's Friday.
All right, so has Representative McGee joined us?
I am here. Just received the link.
Thank you, sir. Would you like to cast your vote?
Yes, Rep. McGee in the affirmative.
I need your camera on, please, sir. Thank you.
Rep. McGee in the affirmative.
Thank you, sir.
I kind of like the album cover.
Did you get my vote, Susan?
No, Senator McCrory. Good afternoon, sir.
Well, good
How would you
afternoon
like to
to
cast
you.
your vote?
Whatever Brandon did. How about that? Yes.
Thank you, sir.
Okay. Are we done? Are we
Yes, sir.
done?
Yes, sir.
Okay.
Representative Reyes, have you joined us?
Madam Administrator, who are we waiting for now?
Representative Reyes, I believe.
I don't
see him, so.
I don't.
I sent the link both, excuse me, both as the resend, and I also cut and pasted it just now. So if you want to give him just maybe, one more minute, but I have sent it twice, so hopefully he'll be able to receive it.
You're holding up the approach meeting. We're waiting for you to get on.
You're gonna miss this when we're not on Zoom.
That's one way to tell him.
He probably thought he had a little bit of time.
Unanimous anyway. Let it run.
Madam Chair, while we're waiting, may I have a moment of personal privilege, please?
You may.
I just wanted to, because I don't know if we'll have another opportunity, and please forgive me if I'm overstepping, but I would just like to recognize the Commissioner of Mental Health Services, Miriam Delphin-Rittman, and wish her the very, very best in her continued journey, and to thank her for what she did for the state of Connecticut. I know we've done a lot of good work with mental health services, so thank you so much for allowing me to express that publicly. Thank you.
Thank you.
Here, here.
Representative Walker, is Representative Reyes coming on?
He said he was, and I don't see him. Yes, we
Yes, I just got off the phone with him. He's trying to log on now.
Tell him to stop talking to everybody on the phone and just dial in. Ignore everybody.
We'll give him 1 minute, and then if not, we'll just close down because it's not fair that everybody sits here.
Since we're gonna miss each other a minute.
Oh, we'll be back next week.
And I hope it's a short meeting.
Don't call me, I'll call you.
Madam Administrator,
Yes, sir.
this is Rep. Berlinski, may I ask if this will conclude our business for the day today?
Yes.
Yes, sir, it will.
Then Madam Administrator, and to my chairs and the chairs of Human Services, I respectfully wish everybody a happy weekend, and I am signing off.
Thank you, sir. Thank you for your indulgence. Thank you.
Thank you.
If you have all voted, you may leave now if you would
Yeah,
like to leave. You don't need to stay on. We're just
Not Human Services, please. We need to reopen and adjourn.
Oh, Representative Reyes is here.
Yes, he is. Representative Reyes.
You're muted.
Thank you, guys. Thank you. Representative Reyes votes in the affirmative. Thank you.
Oh, that was a long vote.
Thank you. Sorry about that, guys.
That's all right. Madam Administrator, do you have the tally?
Yes, yes, Madam Chair, I do. Total number voting. Wait a minute. No, that's wrong. Hold on. Total number voting 34. Those voting yea 34. Those voting nay 0. Those abstaining 0. Those absent not voting 17.
Thank you very much, Madam Administrator. The Appropriations Committee is adjourned.
Everybody have a great weekend. Thank you.
Wait, Human Services, I'll reconvene the Human Services
Aye.
Committee for the
Thank you.
purposes of adjourning. I'll have a motion.
So moved. Rep Case.
Moved by Case and seconded by Dathan. Thank you, everyone. Have a great day.
Thank you.
Have a good week.